5, 4, 3, 2, 1. Hello everybody. My name is Christian Brindle. Welcome to another episode of the Everything Medicare Podcast. Today is July 23rd, 2018. And you folks will have to forgive me, to our regular listeners, for not bringing you a podcast last week. We just weren't able to get around to it. We had an unusually chaotic week at the office, and you'll have to forgive me. I can promise you that it will never happen again. For anyone that's a new listener, again, my name is Christian Brindle. I'm a Medicare expert. I'm a specialist. I work with people and been doing so for many years now. And basically, Medicare is my specialty. Every single week, I bring you a podcast where I talk to you about your Medicare, your Medicaid, your Social Security, and everything that has to do with your retirement. And this week, I wanted to talk about a topic that I get asked about more than anything. And that is, when should I pick up a Medigap? When's the best time? Should I pick one up right at 65? Should I wait later until I need it? For those of you who don't know about Medigaps, and I've done episodes in the past about this, but folks, Medigaps are policies that pay after Medicare. Now, most of you know, Medicare A and B work together to pay a person's medical bills, hospital bills, surgeries, doctor's office visits, medical bills, but they don't pay it all. And what a Medigap does is it fills in the gaps. It pays what Medicare does not pay. And essentially, depending on the supplement or Medigap, in the Medicare world, you'll find that there's two names for the same thing for almost everything, because the government has a vested interest in making everything confusing and not wanting everyone to understand it. I honestly believe that. But essentially, folks, that when you have a Medigap, it, depending on which one, the type of Medigap you have, depending on the company, depending on the plan you get, you could potentially have full medical coverage. No copays, no deductibles, no out-of-pocket. And basically, this just depends. And for a lot of people, that's a huge deal. If you have chronic medical problems, I'll give you an example. If I had a Medigap, let's say, and I had a $50,000 surgery, I could potentially walk out and not pay a dime, depending on my Medigap, or pay very, very little out-of-pocket. Think maybe a couple $100. It just really depends on the type of plan I have, but for the most part, 90% of the ones that are picked up today give you absolute elite medical coverage. And basically, depending on your state, in some states you can't get a Medigap until you're 65 years old. Some states you can, but the norm on the states that you can pick it up before you're 65, let's say you're on Medicare due to disability before 65. If that applies to you, it depends on the state you're living at. Like, I'm in Utah, for example. Utah doesn't allow it, but I also work with people in Florida. And for people in Florida, they do allow it. However, normally the premiums are 10 times what they normally would be for someone over the age of 65, if you pick one up under the age of 65, if your state allows it. So, in my opinion, almost always, you're better off with a Medicare Advantage plan when you are under the age of 65, no matter whether they allow it or not, because usually you're paying well over $1,000 a month just for the supplement, and it's never worth it. You can pick up a Medicare Advantage plan with a $3,000, $4,000, $5,000 maximum out of pocket. And even if you did max it out medical bill-wise, you'd still be coming out ahead. So, for one, you should, in my opinion, unless it's just some special situation, it's never worth picking one up before the age of 65, even if your state allows it. But what about for people that are turning 65 and they're not sure if they should get it then? Well, a lot of that also depends on where you live, how much the supplements are in your market, how good are the Advantage plans. Because when you turn 65, there are two ways you can go with your Medicare. You can go Medicare Supplement, or you can go Medicare Advantage. Medicare Supplement also means Medigap, for those of you who didn't pick that up earlier. So it doesn't just depend on the prices of the supplements in your area. It depends on how good the Advantage plans are in your area too. And those are things that need to be compared. You need to take a look at both sides of the coin. Just because your neighbor had a bad experience with Medicare Advantage plans doesn't make Medicare Advantage plans a bad program. It means that your neighbor picked one that they shouldn't have gotten, one that wasn't good for them, or maybe they should have been on a supplement and they didn't have it compared. But don't let that scare you. Stay with me into segment 2, and I'm going to tell you exactly what you need to look for and how to know when to pick up a Medigap. Stay right where you are. Welcome back to segment 2 of the Everything Medicare Podcast. My name's Christian Brindle. I really appreciate you listening in and tuning in with us today, where every single Monday I talk to you about your Medicare, your Medicaid, your Social Security, and everything that has to do with your retirement and the twilight years of your life. Today is July 23rd. If you live in Utah, tomorrow is a Utah holiday, Pioneer Day, and if you're not in Utah, you don't know what I'm talking about because it's not celebrated anywhere but Utah. But we are on a holiday eve in Utah where I live, being July 23rd. We're talking about Medigaps and when to know when to pick them up, folks. Last segment I talked about how if you're under the age of 65, I wouldn't recommend picking one up, period. Because for one, in a lot of states you can't. They don't allow it until you're 65, even if you're on Medicare disability, but in some states you can, but if they do, it's normally $1,000 a month or higher, almost always. It's just never worth it. Even some of the worst Advantage plans would probably be a better fit than that, because you're paying out $10,000+ a year worth of premium. It's just not worth it. So essentially, folks, what you're looking for is if you're turning 65 or you're over the age of 65. So here's the thing with Medigaps. When you first turn 65, you can get them with no health questions, no underwriting. It's a straight shot. It's your first time going on to Medicare or turning 65. They call it the new to Medicare stage, and no Medigaps can ask you any health questions or penalize you for pre-existing conditions. We know that, and a lot of people pick them up at 65 even if they don't need them because they're afraid they won't be able to get them later. What I always tell people is, if you're working with a good broker that works with all the available Medicare supplements or Medigap companies in your area, then it shouldn't be a problem. I say that because it's just one of those instances where all of the insurance companies available ask a different set of health questions. And for my clients, if they have that concern, I tell them usually 9 times out of 10 I'll be able to find one that will take you. Almost always, because they all have different health questions. Now, there are some conditions that nobody will take. Like, for example, if you're on dialysis due to kidney failure, you're not going to be able to get a Medigap. If you're on chemotherapy due to cancer, you're not going to be able to get a Medigap. If you have something chronic, very extreme, no Medigap will take you, even the ones with the fluffiest underwriting. Okay? But you need to understand that it's not, just because that's the case, it's not always the best case to get a Medigap. And a lot of it depends on where you live, too, and how much the Medigaps cost. See, some places you can get a really good, decent Medigap for $100 a month. Some places it's $200-$300 a month. It just depends on your market and where you live. And it also depends on how good the Advantage plans are. I hate to keep coming back to that, but if an Advantage plan gives you a $3,000 maximum out of pocket, it's pretty good, folks. I mean, or even a $2,000 maximum out of pocket, or something incredibly low out of pocket where, you get your drug coverage included, you're not paying a premium for it. It gives you extra benefits where a Medigap you're paying, let's say it's a bad case scenario, you're paying $200 a month for the Medigap, you're paying, so that's over $2,000 a year in premium, plus you're paying a premium for the drug plan. So if that's your situation in your market, it depends on where you live. These plans and markets are different in every state. But that's why you need to do your homework, and that's why you need to work with a good broker or agent that can walk you through this stuff, that knows what they're doing. It's possible to work with a bad broker. If you haven't listened to my podcast episode about how to know if your broker or agent is a zero or a hero, go listen to that. I walk through everything to look for, what the red flags are, what to look for, and how to tell if you're working with a good agent or not. Because Because trust me, 8 out of 10 agents out there are bad. But the 2 out of 10 that are good are gems, and you need to cherish them and make sure that you're working with someone like that, because it'll benefit you tremendously and make this whole process easier for you. However, so the first thing you need to realize is it depends on how much you're paying right up front for a Medigap. Depends on your market, like I was saying. Some Medigaps, like I said, in some areas, like in Florida, for example, a decent Medigap is going to be ballpark $200 a month. And the Advantage plans are very strong down there, so you don't see many people. I'd say 9 out of 10 people pick up an Advantage program instead of a Medigap. And that's just the way it is. The other factor with Medigaps is they raise the rates every year as you get older. The premium goes up every single year. So not only is it that much starting in year 1, it's going to get more expensive every year after that. There's a lot of factors that come with this, folks, but I'm going to break down my final tips, my thoughts on this topic in segment 3. Stay where you are. Don't go anywhere. Welcome back, everybody, to the Everything Medicare Podcast. This is segment 3. We're talking about Medigaps. We're talking about how to know when you should get on them. This is my biggest tip, folks. Look at your history. Not just your history, look at your family's history. Are you in remission for cancer, but you don't have it anymore? Probably should consider picking up a Medigap if you're turning 65 with no health questions. I've seen people not take them in situations very similar to that, and then their cancer comes back. They're paying through the roof, and they're out of pocket with their Advantage plan, but there's nothing they can do about it. There's no supplement that will take them. That's a real thing. Look at your medical history. Do you have chronic problems? Do you have a history of problems? Does your family have a history of problems? What do you think is most likely? And nobody can tell you what you're most likely to have or if you're most likely to use something better than you. Your agent can't, and your agent only knows what you tell them. You know your body, you know your history, you know everything. You know everything you need to know, folks. If there's a good chance of that, or if you currently have chronic problems, then a Medigap is good. And assuming it's, reasonable. Like I said, it could always not be reasonable depending on your market. If the Medigap's too highly priced and the Advantage plans are too good. Even people with health problems in those situations sometimes should consider Advantage plans over a Medigap. But let's say reasonably, you're looking at a reasonable price and the Advantage plans are good, not great in your area. And that's a lot of places. In that situation, look at your health now. Look at your health history. What have you had throughout your life? Would you bet money that over the next 5 years you wouldn't develop these kind of issues? You know your body, you know your history. So take that into consideration with a Medigap. And, even if you're healthy, is there a chance you could develop something? Of course. Of course, folks. At the end of the day, it's a guessing game. You don't really know. And that's just what it has to deal with, you're taking a chance no matter what you do. But if you're working with a good agent, 9 times out of 10, that agent should be able to find you a Medigap if you want one later down the road. I just hate seeing people pay extremely high premiums for a Medigap when they don't need it. Because a lot of people pick up Medigaps at age 65 due to fear. They pick it up due to fear. They spend 10 years on that Medigap paying all kinds of premiums. It goes up in price every year, and they hardly ever use it. That's a real thing, folks. So crunch the numbers, look at your history, and that's the best advice I can give you. Look at your own history and realistically ask yourself, with my history, with my family's history, and with the health I'm in now, will I have problems? And that's the best advice I can give you. Any agent that says anything otherwise is a scam artist. They're just trying to talk you into something that they want you to buy. It's good for them, not good for you. And there's lots of agents out there that have an agenda to sell you either an Advantage plan or a supplement. A good agent won't care which one you get, as long as it's good for you and you're happy. That's our motto. Folks, I really appreciate you listening, and I appreciate your patience with us taking a week off last week. It won't happen again. It's not something we do regularly. That's our first week missed since we started, and it won't happen again. I appreciate your loyalty. I appreciate you listening. And if you'd like to stay up to date on everything going on, if you'd like daily free advice on what to do with your Medicare, tips, changes, updates, follow us on your favorite social media. Christian Brindle Insurance Services on Facebook, Christian Brindle Insurance on Instagram, Christian Brindle without the E in the end because we couldn't fit it on Twitter. Look us up for Christian Brindle on LinkedIn and Christian Brindle on YouTube for educational Medicare videos. If you enjoyed this podcast, if you learned something that you didn't know before and it was valuable to you, I encourage you to leave us a review, positive one, show it to a friend, share it on your favorite social media, even if you'd be so kind. It helps us out a lot. Thank you so much for listening, and I can't wait to talk to you next week.